Let's talk about pigmentation. So this comment is asking about pigmented scars in particular. So how do you manage these things? So in a perfect world, scars would heal so that they are the same color as the surrounding skin, which makes them much more difficult to see. But sometimes they become dark, and this can happen in people of any skin tone, but it's certainly more common with darker skin. So as a patient, number one, the best thing to do is to try to avoid pigmentation. So the two things that you can do is to avoid sun exposure. So make sure you always have good sun protection, certainly in the first year or two. And also avoid things that rub or cause inflammation. So if the scar, for example, is on your abdomen where your pants sit, you want to be really careful with the clothing that you choose that it's not rubbing on the area, causing inflammation, which can lead to pigment. So as a plastic surgeon, I always like to start with the most simple things. So first of all, always start with a good silicone scar gel. It's easy, it's well tolerated, it's inexpensive. I like the brand Skinuva, so that is the first thing that you should start. You can also consider silicone sheeting, which is like a tape with silicone on it. It can be a little harder to have that work in certain areas on your body, so talk to your surgeon about what they recommend. Okay, so after you've protected yourself from the sun, avoided inflammation, and started that scar gel, what do you do if your scar gets dark? So the first thing that I try is topicals, and there's really two main ingredients that I find work nicely. The first ingredient is TXA, the second ingredient is hydroquinone. TXA is found in a lot of over-the-counter serums. You can just Google and find lots of serums that have this ingredient. Your surgeon will probably have some favorite TXA serums. And then hydroquinone is a prescription product, the one that I like to use. So that will be something you'll need to get from your surgeon. Now these topicals take a long time to work. So once you start them, don't get frustrated. It can take 4 to 6 months for these to do their job, and you need to be consistent. So starting with a topical, I think, is a really easy, less expensive way to go. Now TXA also has an oral version, which has been very effective in my practice for patients with very difficult to treat pigmentation. So it may be worth discussing with your physician as well about the oral version. Now, if I'm not getting enough movement or lightening of the pigment, then I will start to add procedures. And typically I will add microneedling or laser. There's lots of different lasers that are available. And I find that microneedling in particular used with the topicals helps the topicals work better. So that's often the first place I start because lasers can be a little bit problematic with darker skin tones. So microneedling, in addition to the topicals, is really effective in a lot of my patients, but sometimes I do indeed need to go to lasers. And there's a million different options depending on what I see. Your surgeon will certainly have their favorite lasers for treatment of pigmented scars. So say you've tried the topicals, you've tried all the treatments, and the scar just still is dark and not behaving. Then the last step is usually surgical excision and just starting from scratch. So you cut out the problematic area and start all over again. So if you go this route and you have surgical revision, it's important that you remember you are the type of person who develops pigmentation. If you had sun exposure or clothing rubbing or something that may have led to it, make sure you really are careful the second time around, and then let your surgeon know very early if there is any signs of the pigmentation coming back, so hopefully you can prevent it from happening the second time around.